everyone, my name is Pouneh Ghasemi and I'm going to introduce to you all today the new dissolvable electronic devices. I want to emphasize on positive society impact of having these electronic devices in our body which gets dissolved after doing its job. How many people do you know that are afraid or short in budget to do surgery over and over to implant a device in their body and to take it out in another month or later? Let me explicate the revelation of how life-changing these implantable medical devices are in our society. What are these electronic devices? From scientists at Washington University School of Medicine and engineers at University of Urbana-Champaign, it is stated that traumatic brain injuries are responsible for death of approximately 50,000 people annually in the United States. However, this new technology can be used to monitor the activity of mainly brain and other organs in human body. It can diagnose, prevent, or control the problem that is happening throughout the body without the need of second surgery. What does this dissolvable medical electronics devices made of? These bioresorbable devices have sensors that can sense the change in temperature or pressure, which are mainly made of polylactic glycosic acid and a very thin and cost-effective material called silicon. Silicon sheets are in the 20 nanometer range that are water soluble, and the metal that has been used in the device are biocompatible, such as zinc, magnesium, or titanium. Moreover, the whole device is wrapped in watertight polymers, as you can see, which control the rate of dissociation, and it erodes away after a few days. The scientist Rogers assembled a very bendy, floppy, and a very tiny device instead of rigid and thick structure. How scientists tested this device? 0.4% of human body's weight contains sodium chloride, which is the concentration is equivalent to seawater or saline. As an example, a 50 kilogram person would contain around 250 grams of NaCl, which is equal to 40 teaspoons of salt. Due to the salinity of human body, this device dissolves very quickly and easy. Thus, Rogers and Murphy tested the sensor of this device in a bath of saline solution as well as in the brains of laboratory rats. And now they're planning to implant this device in human brain. How does it function? The dissolvable electronic devices send signals wirelessly to the target organ, and based on the health of that organ and any temperature or pressure changes, the monitor that the device is connected to it wirelessly shows the needed information. It can monitor the organ, either brain or any other organ in our body, continuously. In what ways it helps the patient with brain injury and the doctors? Doctors must be able to help the patients with brain injury, especially in severe situations. They can accurately measure the pressure inside the skull, and if the pressure increases, it can lead to further brain injury, and there is no way that the pressure inside the skull can be detected by scanning or any other clinical features. Neurosurgeon attempted to decrease this pressure inside the skull by some sort of medication, and if the pressure cannot be reduced sufficiently, patient has to go under surgery. During the operation, this device can be placed in different locations of the brain and give useful information about the temperature or pressure rises on any part of brain that can assist the surgeons. What are the benefits of this device for patient and the society? This is revolutionary in medical science, as it can provide many benefits for the patient and people in our society. Like, they don't have something in their body for a long period of time, and the most important fact is that this device does not cause irritation or erosion through the skin, chronic inflammation, or risk of infection, and it doesn't get rejected or corroded by the body and the organ they placed it in. It's because due to the dissolving factor. Plus, using these dissolvable devices eliminates having more surgery to remove them, which further reduces the risk of inflammation or infection or any other complications. Majority of people in our society work full time, so they don't have time. And sometimes due to the financial situation, they don't have money to do surgery over and over. and the risk for the elderly people to go under anesthesia for the brain surgery over and over is very high. There is no need for them to worry about this complication, especially for people who are afraid of doing surgery. It can be easily implanted in the brain or other damaged organ for the doctor to directly control the pressure and the temperature or prevent any damage that might happen and use it for further examination. And in the end, the National Institute of Mental Health of National Institute of Health, the Defense Advances Research Project Agency, and the Howard Hoggle Medical Institute provided funding for this research. Thank you for watching.